Discuss with you what HIV and AIDS are, what causes HIVs, what is the transmission of it, what is the preventions, and what are the treatments, and other things that go along with the topic. Causes. Human immunodeficiency virus, which stands for HIV, causes HIV infection and AIDS. This virus attacks the immune system. As the immune system weakens, the body is vulnerable to life-threatening infections and cancers. You can be infected with HIV and AIDS in several ways. Here are the several ways. By having sex, by blood transfusions, by sharing needles during pregnancy or delivery through breastfeeding. Methods. Anyone can be affected by HIV or AIDS, but there's a few steps to keep you from getting infected from these viruses. The first way is getting tested and know your partner's HIV status, have less risky sex, use condoms, limit the number of sexual partners, talk to your healthcare provider about pre-exposure, which is PrEP, and don't inject drugs. Symptoms. The majority of people infected by HIV develop a flu-like illness within a month or two after the virus enters the body. The illness, known as a primary or acute HIV/AIDS infection, may last a few weeks. Possible signs and symptoms include fever, headache, muscle ache, chills, rash, sore throat, mouth and genital ulcers, swollen lymph glands, and mainly on the neck, joint pain, night sweats, and diarrhea. One, tested or diagnosed. HIV is most commonly diagnosed by testing your blood or saliva for antibodies of the virus. Unfortunately, it takes time for your body to develop these antibodies, usually up to 12 weeks. In rare cases, it can take up to 6 months for the HIV or AIDS antibody test to become positive. A newer type of test that checks for HIV antigen, a protein produced by the virus immediately after infection, can confirm a diagnosis within days of the infection. An earlier diagnosis may prompt people to try extra precautions to prevent transmission of the virus to others. There's also increasing evidence that early treatment may be a benefit. On the national level, there is 1.1 million people in the United States that are living with HIV or AIDS. Statewide in Louisiana, there is a total of 30,876 HIV/AIDS cases that have been reported. Locally, in the Lafayette scale, there has been a total of 683. 328 of that are HIV cases, and then 355 are AIDS cases. Remember, be aware and be careful.